Good morning, everyone. Last week, I ran across an opinion piece that caught my attention. It was by a gentleman named John Barry. Last night, I saw him on some news, so I did what a lot of us do. I went to Wikipedia and found out a little bit more about him. He was the author of a 2004 book called The Great Influenza, the epic story of the deadliest pandemic in history. What I learned about him is this book won the New York Times bestseller. He received the Keck Communication Award from the United States Academies of Science for the year's outstanding book on science and medicine, won the September 11th Award for the Center for Biodefense and Emerging Pathogens at Brown University, and was on an advisory committee at Johns Hopkins School of Public Health for refugee and disaster response. So this book was about the 2018 pandemic, which many people called the Spanish flu, which didn't start in Spain. It started in Kansas, and then through military barracks, kind of expanded through the world. But what was important, and I think very interesting about this, is at that point in history, Spain did not censor their media. So the Spanish journalists wrote about it. Thus, it became the Spanish flu. Back to that opinion piece that John Barry wrote, he said the single most important lessons from the 1918 influenza was to tell the truth. That's why we're doing these daily. So quickly, our stats to update you on. Screening questionnaires completed through Easy Visit, 6,346. Total Easy Visits completed, 1,300, and 573 people used the COVID code. Our daily census at midnight was 378 patients. Again, we have 538 beds that can be occupied at this point in time. Testing for COVID-19 at Bryan at the Medical Center. 51 tests have been conducted, 44 negative, 7 are pending, and these 7 are inpatients. Testing at our drive-through, which John Woodrich, our CEO of Bryan Medical Center, will address. We have tested 100 people for COVID there, and at this point, obviously, all 100 are pending the results. One follow-up on the donation questions from yesterday. Nebraska Wesleyan's tremendous support came. They gave us 212 disposable gowns. They're very similar to the ones we're using at our LifePoint drive-through campus, and over 12,000 gloves. Southeast Community College gave us 1,174 surgical masks, 27 decontamination kits, 211 disposable gowns, 51 face shields, and 20,000 gloves. So thank you to SEC and Nebraska Wesleyan University. At this time, I would like Dr. John Trapp to come up to address some of the questions asked yesterday that were more appropriate for a physician to answer. Dr. Trapp is our Vice President of Medical Affairs, as you've heard before, and a pulmonologist here in Lincoln.
Well, good morning. Again, big shout out to all the donators for Bryan and all the help. Very much appreciated by the medical staff. A couple questions that were asked yesterday that perhaps we didn't get complete answers to. One of the questions was, how long can someone have COVID-19 and be asymptomatic? Great question. Wish we had the answer to that. Right now, we're testing primarily patients who come in with symptoms. We may test people who have had exposures. So we do know that people can be asymptomatic and have COVID-19, but how long? Unknown. We just simply don't have that answer right now, so it's going to take some time to really answer that question. How long does it take for COVID to run its course? The answer to that is it varies. Some patients have a very mild course of illness that may only last 3 to 4 days. Other people may have a more prolonged course requiring hospitalization, intensive care management, and even respiratory failure. For the ones who have the more mild case, this may last 3, 4, 5 days and resolve. Again, for other ones, it may last for weeks. How long after you have COVID-19 is one contagious? Well, the current thought is that you are contagious as long as you have symptoms. We know that early on in the onset of this disorder, when you have symptoms of fever, cough, actually you're highly contagious. As the disease resolves, as temperature resolves, you become less contagious. The current recommendations are to remain isolated until you have no fever, and that's without the use of fever-reducing medications such as acetaminophen or other nonsteroidals, or 3 days after symptoms have resolved. That may be cough. you should remain isolated until either of those, the longer of which, goes away for a minimum of 3 days. So for that means for most patients that you would be in isolation for probably a minimum of 7 days, assuming that you have a 3 to 4 day course of illness and then symptoms resolve, and then you remain in isolation for 3 additional days. The other question, if you get COVID-19, do you build immunity and can you get it again? Great question. A lot of investigation going on to answer that. The belief right now is that you can build immunity. When they've tested patients who have been tested positive for COVID-19, there are some antibodies that develop within the serum. How long those last, unknown. But you can build immunity towards it. We just don't know if that lasts several months or does it last for years. Again, the coronavirus is one that's very prone to mutations, and so that virus can change over time as well. So you may be susceptible to mutations of the virus over time. I believe those are the questions that were asked yesterday. I hope I provided answers for you. If you have further questions, I'd be happy to answer those as you text those in. Thank you.
Thanks, Dr. Trapp. I'm John Woodrich, CEO of Bryan Medical Center. Wanted to give you some update in regards to the drive-through. So yesterday we saw 56 patients. Of the influenza, none were positive, so that's the second day in a row. So after seeing 100 patients, 0 have tested positive. We will be continuing with the influenza today and probably making a decision of whether we will continue to administer that. And I think this is a good indication of just social distancing and people staying within their homes. The previous week we had 50 positives. So this is really working, folks, if you go ahead and keep yourself isolated and keep that social distancing. The respiratory pathogen panel, we had 6 positives yesterday. So the 2 days combined gives us 10. So we're at about a 9% positive rate, which is identifying another virus. And then the rest we have sent out for the COVID testing. We will continue to monitor the percentage that we're identifying with a positive respiratory pathogen panel and make a determination if we continue those into the future as well. So we did schedule 60 people for the day. We did have 3 no-shows, and then there was one individual that we thought it would be better if they went into the urgent care center, a younger individual, to perform that test. I did want to let you know that today, as of about 10 minutes ago, we have 44 people scheduled in that slot of 60 that we have available today. I do want to reemphasize that the COVID testing is approximately 4 days from when we get the results. So the ones that we did a couple of days ago, we're still a couple days away from getting those. I did want to share with everyone, we continue to work on plans for when a surge would occur here. And we're working with our hospitals across Nebraska that we have a strong relationship with, which is the Heartland Health Alliance. A lot of these critical access hospitals, there's about 50 of them. Friday we will be meeting with them via Zoom, as everybody else has been doing. And we're going to talk about alternatives from a telemedicine perspective, and also if they have a person present at their facility that ends up being positive, how we would transfer them or how we would care for them at that facility. We're also looking at options that if for some reason the surge is really heavy in this community, that we're filling up a lot of the beds here, that maybe our lower acuity patients, non-COVID, we can take care of them in those other hospitals. Through telemedicine, we can have a lot of our specialists be looking over those patients and providing care. So we are in the planning stages of continuing to look at when a surge occurs, how we will handle this across the state and working with our other hospitals.